Good evening, Fighting Scots. For those of you who don't know me, I'm Jen Armstrong, the Director of Alumni Engagement at Monmouth College. And I want to welcome you to our event tonight titled Health Benefits of Optimism During a Pandemic with Doctors Marcia Defide and Joan Wertz. We're so thrilled that you are joining us. Before we begin, I want to just cover some housekeeping items. This event is recorded and it'll be available on the Monmouth College website next week. For the best viewing experience during the presentation, please ensure that you are in speaker mode, which can be selected in the upper right-hand corner of your screen. Your cameras are off right now, but in the middle of the presentation, we want to invite you in to participate in the class. So we'll turn on your cameras by promoting you to panelist. So you might see a yes or no option. So please say yes when you get that question. And then you'll be in the room with us and you'll see your camera kind of along the side like you see ours. And if you want to keep your cameras off, you can manually do that by selecting stop video on the bottom bar of your Zoom window. And at any time, if you want to ask questions, you can do so in the chat feature on your screen. At the end of today's event, you'll see a short 3-minute survey appear in your web browser. Please feel free to use the survey to offer your feedback and suggestions for future events. So now I want to tell a bit about our presenters. Dr. Marcia Defide found her passion for how the mind works at her nursing home job during her college years. After receiving her bachelor's and master's from Western Illinois University in Macomb, she received a PhD from University of Missouri, Columbia. In addition to her work as a professor here at Monmouth since 2017, she researches the potential effects of acute or chronic exposure to low doses of herbicides and pesticides on cognition and behavior. She currently serves as the chair of the psychology department. By the time Dr. Joan Wertz, sorry, my contact is off center. By the time Dr. Joan Wertz was a sophomore in college, she knew she wanted to be a psychology professor in a small liberal arts college. She's always been drawn to the biological side of psychology and studies the correlation of anticipation of future drug use and cravings. Dr. Wertz received her bachelor's from Allegheny College in Pennsylvania and her PhD from the University of Pittsburgh. Monmouth students have benefited from her experience since 2007, and she currently serves as Associate Dean of Academic Success. So I know even the most optimistic of us have had a challenge this year with this pandemic, so I'm really looking forward to this talk. I'm sure everyone is in the room, and so doctors, the floor is yours.
Thank you very much, Jen, and welcome everybody. It's really great to see all of your names. We're looking forward to seeing your faces at the end. We were actually talking before you came on that maybe it's good that we can't see your faces yet because we would be so distracted that we wouldn't get through our presentation. So welcome and thanks again for joining us. You brought us a lot of joy as we were preparing this little presentation today, this class. So it's been fun looking forward to it. And again, it's on the health benefits of optimism during a pandemic. So the life orientation test, of course, is a test that we asked you to take regarding how you feel about your life. It was initially created by Shire and Carver in '85, and it's actually the most accurate and largest online test of optimism in the world. The test essentially utilizes your outlook on the future to measure your overall levels of optimism and pessimism. And you might remember, if you looked into it a little bit when you took part in it, that individual scores are compared to others from your part of the world and also in your age group who've also taken the test. So I'm not going to run through every single statement that was in the test. And I know many of you already remember what reverse scoring and direct scoring and all that fun stuff means. But you can see with each question whether it was just a filler item or it measured optimism or pessimism. So generally, the life orientation test includes statements about how we feel about ourselves, others, and about life in general. And then statements about how we feel about ourselves, others, and life when we are under stress. And then also statements about how we feel about ourselves, others, and life during the happy times. And in terms of interpreting the results, you may have looked further into this yourself as well. But as mentioned in that Harvard Medical School article that we had you read, Optimism could be measured according to both dispositional optimism and to explanatory style. And dispositional optimism pretty much concerns your general expectations regarding the future. And this is really the primary focus of that life orientation test. And then just to kind of elaborate on a little bit, your explanatory style is really how you just explain good and bad events in your life, or good or bad news that you might receive in your life. And generally, when it comes to explanatory style, pessimists tend to take bad news as personal, permanent, and pervasive. So a pessimist, if they receive bad news, they will think it's their fault. They will think it's never going to end. And they will also take that bad news and it will kind of filter out to all other areas of their life. And then optimists, on the other hand, will take those same 3 Ps, that personal, permanent, and pervasive, and use those when it comes to really good news and good events. And so then you're owning all of that good news and you're thinking that those good events are going to be permanent and also will filter into other areas of your life. So in regards to your score, when I took this test myself, some of you who know me well won't be surprised that I scored in a moderate range of optimism based on my score. And those of you who know Dr. Wertz well will also not be surprised that she scored very, very high. She scored like a 22. So that's no shock. But anyways, higher levels of optimism are related to greater subjective well-being during times of stress and adversity, also to better social adjustment and emotional regulation, also being able to express yourself more, being hardworking, and also greater achieving. And finally, at being better at personal and professional fronts. And this is true across all ages and across all cultural backgrounds. So in terms of your results on this particular life orientation test, you can take those results and think about how you actually would rank in each of these different areas of your life. And of course, being psychologists, we love to think about the psychological benefits of optimism and some of the other positive attributes that are paired with it. And so we just listed here some of the other ways that were not touched on in terms of that particular test that are also positive attributes of optimism. So just a few of them. So of course, increased happiness, definitely increased motivation. You're definitely more motivated when you're feeling optimistic about life. Increased hopefulness, self-esteem, self-confidence, gratitude, definitely an increased sense of achievement, and of course, increased resilience, which some of you might remember Dr. Wertz is also very interested in terms of college students.
Okay, so we sent you a link when you registered for this to an article that Harvard put out that kind of highlighted a number of different areas of research that have shown that people with optimism tend to experience different health. Or I'm sorry, not different health, better health. And so just to kind of highlight a couple of things here. The research that they reviewed in that article indicates that optimism helps people cope with disease and recover from surgery better. There's some interesting research that if you measure optimism or pessimism right before people go in for a cardiac bypass surgery, that the optimists actually recover better. They're ambulatory sooner, they're up and moving faster, they get home faster, and then at 6 months, they're also doing better and recovering better than the people who scored low on optimism. There was also quite a bit of research in there that talked about how optimism is related to a lower risk of high blood pressure or hypertension and experiencing coronary heart disease in the first place. One of my favorite things to kind of point out about this is that as we get older, especially, optimism, it can be really helpful in helping people to stay independent a lot longer. And it also increases our lifespan, which, you know, is pretty important. So not only are you living longer, you're living more independently also, which I think is really kind of a nice thing. So that article highlighted a bunch of different studies that were done in the US, also some studies that were done in other countries. There's lots more research besides for what was talked about in there. So I kind of like the idea that people keep doing this research on optimism and how it's related to health. And we keep consistently finding that in lots of different areas of our health, that we're getting this benefit from optimism. You can go ahead and switch, Marcia. Okay, so again, being psychologists, we really want to know why. Why are we seeing better health? Why are we seeing longer lifespans? Why are we seeing better recovery from surgeries? And I think there's probably a number of different reasons for this. First of all, people who are optimistic probably are living healthier lifestyles. They are more likely to exercise. They're less likely to resort to substances when they're coping with stress because they probably have better coping mechanisms, right? And healthier coping mechanisms. They're also more likely to be married. And being married has health benefits in and of itself, right? So that might be a connection there. Martin Seligman in the Learned Optimism book that I use in my health psych class. So some of you on here have read that before. Hopefully you remember it and you enjoyed it as much as I enjoyed it. He also suggests that people who are optimistic are more likely to seek out medical help. Like, so if you start to feel some symptoms, you might actually be more likely to go to the doctor more quickly to follow up on those sorts of things. So they're getting better medical care. And they're more likely to follow medical advice, right? Because they're thinking forward and they want to be happy and they want to be healthy. And so when they're getting advice from doctors or, from educational sources, they're more likely to actually follow that advice too. And it turns out because optimists are more proactive as they're thinking about all the different events in their lives, they're less passive in responding to events in their lives or potential threats or potential challenges that might be coming up in the future. And so it turns out that there's some evidence they might actually be able to prevent some bad events from happening. It's always this interesting question of, are people do bad things happen to people and that causes them to be a pessimist, right? And if you don't have a whole lot of bad things happen to you, maybe that's why you're an optimist, because life has been pretty good. And it makes sense, but the evidence is actually suggesting that it's the other way around, that optimists probably have fewer bad things happen to them. They still have bad things, but they have fewer bad events happen in their lives because they probably are more proactive and working to avoid some of those negative events ahead of time before they actually happen. And then finally, in terms of behaviorally, optimists are better at getting and using their social support networks. I was just talking about optimism this week in my health psych class. And I said, to the whole class, if you had the option of hanging out with an optimist or hanging out with a pessimist, who do you choose to hang out with? And everybody, of course, said that they would prefer to hang out with an optimist rather than a pessimist. I'm like, that's probably why they're better at getting and using social support, because all of us, pessimists too, we have people who love us. We have people who care about us. We have people who are in our social support networks. But when you're really going through something that is challenging and requires extended support from your support network, it's probably easier for people to keep supporting people who are a bit more optimistic or more positive in their overall outlook and how things are going to be moving forward. And then finally, in terms of biological reasons why optimists might be more healthy, and I think it has a lot to do with the amount of stress, right? And optimists might be experiencing less stress in their lives. And so they have less of this physiological stress response, which, the HPA axis, some of you are going to remember me talking about the HPA axis, hypothalamus, pituitary, adrenal glands, that gets activated whenever you're in a stressful situation. And the end result is inflammation. The end result is cortisol and other stress hormones. And those things can have an impact on our physiological health. And in particular, we've known for a while that there's that link between high cortisol levels and immunosuppression. So our immune systems are actually functioning better when we're not experiencing as much stress. And so I think that that's probably a very likely link, that optimists are having better immunity because they overall are experiencing less stress, or they have more proactive responses to stress in their lives. Okay, so moving from the health impacts overall of optimism into how do we actually apply optimism to COVID-19? Martin Seligman, my little psychological crush, I love this man. He's at the University of Pennsylvania and runs the Positive Psychology Center there. He was asked recently, how do we use optimism to help us move forward during the pandemic? Because a lot of people are really stressed out about the pandemic. It's really been a challenge for mental health worldwide, and dealing with this, the uncertainty, dealing with the illness, dealing with the loss that we have all been experiencing. And his response was, okay, let's work through this in 4 steps. And the first step, he said, is to actually spend time thinking about what is the worst possible situation that could happen. And at first, when I read this, I was like, really? That's where you want to go with this? But his reasoning was that we do it anyhow, right? Many of us, that's our first thing. We start thinking when things are really stressful, it's like, oh my God, bad things are going to be happening to me. So he actually says, go ahead, embrace it. Your mind is already going to be going there anyhow. So go ahead and give yourself the permission to be thinking about what is the worst possible situation or the worst possible outcome that could happen, because of COVID-19. And so, of course, many people are thinking, all right, I'm older or I'm in a vulnerable condition. And if I get sick, I might die, right? If I actually get the coronavirus, I might die from that, or I might end up in the hospital, or I might lose my job. And he said, okay, go ahead and take some time. Think about those worst possible situations. But then you have to change your thinking. And so after you allow yourself to think about what is the worst possible outcome here, make yourself change your thinking into step 2, which is to think about what's the best possible outcome, right? So for lots of people, the best possible outcome is I'm never going to be exposed to COVID or to the coronavirus, and I won't get sick from it. Or lots of people are asymptomatic. They're exposed to it and they never get symptoms, right? So that is a potential outcome for this too. And then he says, move on to the next step, which is, okay, you've thought about the worst, you've thought about the best outcomes. What is actually most realistic or most probable outcome that can happen? And probably for many of us, and this is probably true for many of us already within the past year, we were exposed to the coronavirus and we did end up getting sick, or somebody that we know was exposed to it and somebody that we know ended up getting sick. And so if I were to get sick, what's the most likely outcome? Okay, well, most people come through it okay, right? 80% who don't really have very serious symptoms at all. I think I heard recently that the hospitalization rate for positive cases is currently about 1%. The case fatality rate, it's hard to estimate that exactly. Those of you like Kelsey who are in public health, you know that in the middle of a pandemic, it's really hard to know exactly what all of those statistics are. We're going to need some more time to figure all that out. But the case fatality rate is going to be well under 1% also. So what's most likely to happen if I get sick? I'm probably going to have some symptoms, but they're probably not going to be too bad. Okay. So you have to get out of thinking about that the worst possible thing is what's probably going to happen to you. You have to make yourself think, okay, what's the most realistic thing? What's most likely to happen to me? And then step 4, Seligman suggests that, okay, well, let's develop a plan for the most realistic scenario. So what happens if I am exposed? What happens if I do come down with symptoms? What do I need to have in place so that I can cope with this, right? So do I have enough food and water, or, and drinks and all, vitamins and medicine and all that sort of stuff at my house if I can't leave in order to do shopping? In our department, because, we rock. Last fall, when we came back, we actually made a plan and said, okay, what happens if one of us needs to go into isolation or one of us needs to go into quarantine and we're not able to teach? Who can cover, right? So I can cover Marsha's mind, brain, and behavior course, right? So we came up with a plan, figuring that this is likely, right? This could actually happen. And we knew who was going to step in and take over which courses for which person. So, come up with plans for childcare, come up with plans for, can you work at home? Come up for plans with, if you can't work, is there somebody who can actually take over some of your responsibilities? So I really like that Seligman talked about it in this particular way, because he's recognizing that many of us, and I know some people personally, they've been stuck at number 1 for the past year. Their lives have been controlled by the fear that they are going to get sick and they are going to really have some negative consequences from this. And, they've really, really had a hard time in the past year. And so if you can use a little bit of optimism and kind of follow these steps and say, the worst possible outcome is probably not the most likely outcome, right? Then it helps you to start having a sense of agency and a sense of control, and thinking about, okay, how can I actually prepare for this, and what's the most realistic scenario?
Okay, and in building on that, I definitely appreciate that whole section, because thinking about how you can put those steps into action specifically related to COVID, I think is really, really helpful and useful. And to kind of take a little bit of a step back and think more broadly about some of Seligman's work, he does talk about in many of his books 5 core elements of happiness and psychological well-being. And some of you might remember that these make up the PERMA model. And we will talk through what each of these letters stands for. And I think that putting this in the context of COVID or any of our future challenges that we have is helpful, because it reminds us of the lens through which we should try to approach life. So building on that previous slide and then thinking more about some of the other really great ways that we can move forward in an optimistic fashion. So the first one for P is positive emotions, or essentially just feeling good, right? So focusing on the positive emotions that you have regarding your past, regarding your present, and even your future. So this, of course, is going to be really constructive and help you maintain that optimistic perspective. So it's going to be really, really crucial to just helping you enjoy your daily lives and helping you persevere with all of the challenges that life brings. And even some of the eventual outcomes that you might not be anticipating. And then we have engagement, and Seligman is very big on finding flow, as well as Csikszentmihalyi talks about that too. So it's really important to find those things that you just find engaging on the day-to-day basis. We all need something in our lives that just helps us get absorbed in that current moment, helping us find that kind of, I kind of refer to it as a blissful immersion in some sort of task or activity. It helps you escape from some of the realities of the world, helps you just kind of get yourself in your own little moment. It kind of stretches your intelligence, stretches your skills. Trying new challenges is just good for you, right? And so engaging in those activities are going to really help provide you both a mental and emotional escape from the day-to-day life. And in terms of relationships, as Joan was mentioning previously, that having that strong social support is really, really important. And so making authentic connections with others is just huge. We're social animals. We're hardwired to bond with others. We're hardwired to depend on others. And it's a basic need, right? We need to have healthy, authentic connections. And we thrive when we have those really meaningful relationships, those relationships that promote love, intimacy, and just really strong interactions with other people. And so these relationships are going to be really important to providing you support, as Joan was mentioning, in difficult times that require resilience. And our pain centers become activated when we're at risk of isolation. There's a lot of research showing that isolation activates our physical pain centers as well as our emotional pain centers. So we need to, really be focusing on trying to find those we don't need to have a lot of relationships, but they need to be authentic. They need to be real. Finding meaning in life is really important as well in helping us approach challenges. So making sure that you have a purposeful existence. And this could be, some people find meaning in religion. Some people find meaning in, some spirituality or a spiritual practice. But you can also find meaning in other different ways. I mean, I've found great meaning in teaching, right? Some find great meaning in working for a good organization or raising children, volunteering. Anything that really allows you to express yourself creatively is going to be really good. And it's also going to help you kind of reframe some of the ways in which you actually view life's challenging events, right? So sometimes people will lean on religion during tough times. They will rely on some of the other areas and aspects of their life that are going really well and where they do find purpose and meaning in order to kind of serve as a counterbalance to some of the challenges they're experiencing. Then A is for achievement, and essentially that's, trying to find sense of accomplishment where you can. So having that sense of accomplishment, making sure that you keep yourself goal-oriented in some ways. Having ambitions is a great way to keep you motivated through life. And of course, not just having those ambitions, but when you get that sense of accomplishment from making progress on those ambitions or on those goals. You feel pride, you feel accomplishment, fulfillment. It's really, really good for your overall well-being. And so pushing yourself to thrive and to flourish, even when we do have challenges in front of us, is going to be really important. So again, PERMA is a really good model, I think, for helping us kind of reframe or a good lens for looking at life and looking at challenges that will help promote happiness and well-being. And so after going through all of this material, we were wanting for all of us to hop on together, and we can think about both the previous slide and also this slide in terms of how might we apply Seligman's work, and how might we think about some of the factors from the life orientation test and the article that we read in terms of managing COVID and some of the challenges that come with it. So a little bit of a brainstorming session now, so we can share our ideas with each other.
And it's probably going to take a couple of minutes for everybody to be promoted from an attendee to a panelist. While you were doing that, I thought maybe Marsha and I could offer up a suggestion of, things that we have done that kind of fit into this PERMA model as we get through COVID. And, for almost a year now, it was toward the end of March, shortly after the whole lockdown thing started last year, that my family, because we always like to play games together, and we are spread out in a number of different states, we have a nightly Zoom call, which actually they're doing right now, but I'm here, and we play Yahtzee together. And so it's my mom, it's me usually, my brothers and sisters, some of my nieces and nephews, sister-in-law is often in there. And it has been a great way for us to to kind of work on the R here, I guess, right, of the PERMA model, is that the social support that we have been getting from our family, I think, has been, really helpful. And then plus the positive emotions. You guys probably don't, most of you don't know my family, but we spend an awful lot of time laughing. And so I that alone has worked for me. And, we've even talked about how once the pandemic is over and things are back to normal, we're probably going to keep doing these Zoom calls, maybe not every single day, but we'll probably keep doing them and getting together because we enjoyed a lot. And Marsha picked up a new skill.
Yeah, so I can talk just about a couple of things that I've done. I've actually tried to focus on most of these. So one thing that I've done is I've tried to find different ways to engage in life. And so I started out with practicing origami, which was really fun because then I would give people, tips in the shape of flowers or roses or whatever. So I learned origami for a while, and I had all sorts of origami animals all over my place. And I also decided that I was going to take up learning how to play the ukulele. So I bought myself a ukulele, and I've been practicing the ukulele on a regular basis and got the good calluses going and all that fun stuff. And so it's great. When I first started, I did not realize how locked in I would really get, but half an hour, 45 minutes can go by, and I don't even realize that there's been a passage of time. So very, very engaging, just challenging enough to give me something to focus on. But definitely fun enough to keep returning to it. So that was me working on the E. And I also, which some of you might know, I also decided to work on A a little bit. And I decided to, in conjunction with me being on sabbatical and having summer, I was able to try my hand at going back to school. And so I took 2 master's classes in the Master's of Public Health program at University of Florida online. And so very, very fun, gave me a sense of accomplishment. I didn't know if I'd be able to be a student again. So yeah, great sense of pride and achievement that came with getting through those classes as well. So yeah, so just a couple of ways in which we have tried to apply these models to getting through COVID. And I'm not sure how many of you have jumped on. I've got to change my screen settings here, but you're welcome to chime in with your own ideas.
Oh, come on. Some of you guys did some fun things that are helping you get through the pandemic.
So I had, when I moved up to the Quad Cities, I was originally I didn't know anybody up here, and anybody who knows me, I'm very social. So that was very difficult for me. So I started doing yoga and I liked it, but I was busy. I was doing things all the time. So then when I didn't have anything to do besides go to work, I'm signed up for, I got like addicted to yoga, and I'm going to complete my yoga teacher training in the fall. So I'm pretty excited about that. It really covered, let me move my screen so I remember all of the, yeah, I mean, it really covered all of the perma things for me. You know, you just develop such a unique relationship with people in that setting. So, and yoga really is for everyone. Most of my yoga classes I go to, I am the youngest person by like 40 years. So yoga's for everybody.
That's great. That's very exciting. Other ideas?
Hi, Marcia. It's Christine Amanda.
Hi.
I don't know how we're supposed to compete with learning the ukulele exactly.
It's tough.
For me, it was focusing on the sense of accomplishment and achievement that you discussed earlier. I think so much of the gains that we've learned in the past year, I really had to break down into what is the most salient need in front of me for the clients that I serve. So maybe I wasn't going to do in-depth therapy that day, but someone hadn't had a roll of toilet paper in the last 2 weeks, or needed me to go and pick up food from the local food pantry. So focusing on not changing everything, but focusing on those really small ways that we can help and not feel paralyzed by the lack of helplessness in that situation.
Yeah, and I got to work from home full-time remote, and I love it. We lost one of our beloved dogs in August, and I got to spend like the last 6 months at home with him. So it really was like a blessing, weirdly. And I also took up learning French. So it's no ukulele, and I'm still terrible at it, but trying to flex those muscles.
I think that's more impressive than the ukulele by far.
I found a roll of toilet paper.
I was going to say, Amanda, that learning French might be a little bit more useful in life than playing the ukulele. Maybe not as much fun, but.
Other ideas?
For me, at our work, we had an outbreak around Christmas time, like 2 days before Christmas. We got a email saying that there was a positive test in one of the residential facilities that I wasn't at, but I was in the other location. So I had been with a lot of contact with them. So basically it was an entire shutdown of everything, and a bunch of workers that were all in contact with them had to be quarantined and stuff. So just like being able to be healthy and pick up those shifts like for people and to help people out, that like definitely filled the sense of purpose thing for me, because I felt like I was, able to do that for them because I could, whereas like a lot of people probably didn't. And I know the stress of like trying to find coverage while you're already like super sick, and like COVID could obviously wipe you out and everything. So just being able to do that was really good for me. Plus extra hours for me, extra money. So that kind of fulfilled some stuff for me too.
For sure.
So I learned how to meditate during the pandemic. I've always wanted to learn how to meditate. It's always been like a time problem. Well, I had plenty of time, and I highly suggest it for stress. Like, it is just such an effective, like, guided meditation is wonderful for stress. If you just have a stressful day, like even if you can get in 10 minutes, it's incredible. So that is the one thing I want to share, that I took the time how to do that, and then now I have a regular practice, and it's been amazing for stress.
I saw in the chat, Vicky, that you had a question of how does a person who is a strong pessimist become more optimistic? And students who have taken my health psych book know that or my health psych class know that I love this book. Martin Seligman actually has a book called Learned Optimism. Because he will tell you that he's a born pessimist. And after he started doing a lot of this positive psychology work, he realized he needed to change from being a pessimist to being an optimist. And so it's probably going to be a book that's pretty easy to find on Amazon. The original version of this came out, I think in the mid 90s is when it was first published, but there's been a couple more like updated versions or republishing since then. So again, it's Learned Optimism, How to Change Your Mind in Your Life. I would also recommend the Positive Psychology website that the University of Pennsylvania runs. There's lots of good stuff. It's not just on optimism, but they have a lot about happiness and flourishing, you know, and lots of other positive things on there too. So that's what I would recommend. I always tell my students, like, you're not just going to wake up and decide, hey, I'm going to be optimistic today, right? It's not going to happen that way. But it really is, you know, changing a pattern of thinking, and changing a pattern of thinking takes some effort, and it takes a lot of practice until it becomes a habit. But it's definitely possible. The Harvard article actually said at the end of that, I don't know how many of you guys caught it, that, you know, there wasn't necessarily a whole lot of evidence that you could change, but Seligman's been saying for 25 years, yeah, you can work on changing this and actually become a bit more optimistic. Yeah. Are there other questions that you guys have?
Joan, I have a question. I think part of the hardest part for me in keeping positive during the pandemic has been the ambiguity. I feel like if we had a set end point, I could like grin and bear it.
But when does this end, Joan? That's our question.
Yes,
what's the end?
No, but what?
July 4th. President Biden said July 4th.
Are there any strategies to cope with that kind of ambiguity? Because I think that's testing even those of us who try to be really resilient and positive.
Right. And if things are really predictable, they're much less stressful, right? You know, and so the ambiguity makes things a lot more stressful. I think, Amanda, finding the things that you can control, like you can't control the pandemic, you can't control what other people are doing, but you can control what you are doing, right? And so I think for a lot of people, it's, you know, getting the vaccine when it becomes available to you and encouraging other people to get vaccinated, and to, you know, wash your hands and social distance, and don't spend time in big public places, right? And encouraging other people to do those kinds of things, which there's good evidence that this stuff is all working for us. I think if you can focus a little bit more on individually, what can I do to protect myself? What can I do to get through this? It's easier than trying to think about the whole world is dealing with a pandemic and we're not going to get through this. Yeah.
Yeah, I think that's really important, is to remember to focus on only what you can control, and those things you can't control. Is it really worth spending your energy and mental and emotional resources pondering it, you know, and ruminating about it when there's nothing you can do about it? So try to put your energy where your resources are best spent, and they're best spent on the things you actually do have control over. Any other questions or suggestions? Again, if you have any suggestions you've thought of.
I don't really have any suggestions or anything, but this is really kind of a good timing for a presentation like this, because I look, so I work for a health center where we've been testing for COVID. We were hot and heavy testing 300 people a week in July, and now we're down to like 12 a week, which is good. It's great. But we also have low numbers. We don't have a lot of patients because they're still nervous to come in on our medical side. And so I look at our nurses and our staff and how exhausted they are, and they're really pessimist because they've been dealing with this and working so hard to deal with it in the past few months, and now they're just kind of in this lull, and they're all getting very pessimistic and very brought down, and a lot of them have said that it's affecting their health. And it's interesting because we just started a step challenge. So the goal is you're all in teams. So we have that relationship. And the goal is whatever team walks the Appalachian Trail first wins. So it's kind of been a good way to get them out. And now that I'm like, oh, this is perfect because I can make it relate to their optimism as well and hopefully bring them up a little bit.
I think that you make a good point, Kelsey, with that. And it goes back to what Amanda was saying too, is that, you know, people are starting to feel pessimistic because we don't know when it's going to end. And we were feeling really hopeful there for a while. And now Fauci's saying that we've plateaued and we can't be too excited to loosen things up yet. And so, yeah, I think that it's perfectly normal, right? I mean, Seligman even includes some research in his book where he talks about feeling no control at all is worse than even being able to predict if something bad is going to happen accurately, right? It's just that lack of control is just very, very uncomfortable. So yeah, it's very fitting that you mentioned that as well.
I can also add that for me, exercise has been key, and this may have been covered at the beginning, and I had a work call, so I apologize, I was late. But doing that in the morning has been key for me because it helps me clear my head. It helps me feel accomplished. And then I can just get straight to my day and not feel like I've missed out on that opportunity, depending on, you know, what will come along.
Well, and exercise has all kinds of wonderful mental health benefits, whether you're in a pandemic or not, right? You know, so it's a good thing right now in particular, but I think it's a good thing for all of us to try and prioritize all the time. It's good to see you, Evie.
Good to see you.
Any other questions from you guys? This is really taking me back to class with all of you guys. What questions does the class have?
Did they have, do you guys have any, like, did you read anything on the pandemic, like regarding, I've heard the phrase like toxic positivity, like using too much positivity, like to the point where it's almost damaging. It kind of like reminded me a lot of what Kelsey was talking about, like in the face of, you know, a nurse or something, or a teacher or someone that's saying like, oh, I'm so stressed, da, 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 da. And then to be back to them saying something like, well, just look on the bright side and look on when for them, like almost there isn't one. What, you know, how do you, like, how do you address that or help them, you know, find that optimism in their lives when there is a lot of stuff like going so stressful for them?
I'll take a stab at this, and then Marsha, you can jump in there too. My first thought, Lydia, as you were talking about, is optimism is beneficial if it's realistic optimism, right? Instead of unrealistic optimism.
Sure.
Because if you're just thinking, oh, everything's going to be fine, I don't need to wash my hands, I don't need to social distance, you know, we're going to be through this in 2 weeks or whatever. That's not helpful in the long run because, you know, that doesn't pan out. And you kind of, you know, a year later, here we are, right? And so I think being more realistic is really a big part of that, right? About moving forward in a healthy way. And then I would also say, in terms of people not taking the concerns of others seriously and just trying to brush them off and say that, oh, it's going to be better, look on the bright side. And I've heard a lot of people saying recently, and I'm glad to hear people saying that it's okay to not be okay. Instead of trying to always put on a happy face, we're all struggling at some point or another, and we should just be more comfortable talking about how this is hard, right? I walked to class this week and my students, it's a hard week. They're not getting any breaks right now. This would normally be our spring break time, and we don't have a spring break, and they're dragging. And I just acknowledge that it's really hard. I know you guys, I know this is a tough time. We're going to try and get through this, and let me know what I can do to help, you know, those sorts of things. So I think it's really important for us to all keep in mind that you do have to acknowledge that things are tough and that people are not always okay. Now, if that's, if people are telling you that, you know, that's a great question. How do you respond? And I think
it's a lot of, my mom's a teacher. She's a high school special ed teacher. And she's, I guess that, yeah, she's getting real tired of people telling her like, oh, it'll all be fine. And she's like, I don't even know when this is gonna end, you know. So that, yeah, that's a lot of it.
And I think a lot of people default to telling others it'll all be okay, it'll get better. And instead, I think that sometimes there's value in just acknowledging that the person's pain or frustration is real, hearing them and saying, well, I'm here for you to the extent that I can be. And I acknowledge that you're feeling this way, and it's normal. But yeah, I think a lot of times we're just so driven to try to cheer people up that we almost don't acknowledge what they're experiencing because we want to say it'll be okay in the end. So yeah, I think being realistic and yeah, like Joan was saying, letting people just feel what they're feeling and acknowledging that they're feeling it. And kind of going back a little bit, when you first mentioned people being overly optimistic, it reminded me, and some of you might have seen this in a class of mine or two, there is actually something called the Optimism Bias, and Tali Sharot, Sharot, has a good TED talk on it. And this is exactly the bias that causes the smoker to think they will never be the one to get lung cancer, right? Or the person who doesn't wear their seatbelt to think they will never be the one to get in a car accident. So kind of fun little video to watch that kind of shows a little bit of the opposite end of the spectrum than what we're encouraging here, but it's a good talk.
Thank you. Yeah, that being able to reply with that realistic, or I can't remember the term you used, the like appropriate optimism. That's like really good advice, especially like in all the different fields that we're all working in and everything. Thank you.
Sure.
Any other questions or shout outs or?
This totally makes me want to be back in college.
Get a job teaching, Claire. You get to do this stuff all the time.
Hey, you know what? Banking is great, but it's not it. Let me.
It's not the same. It's not. Like, I'm going to school for my master's, and it's just not the same as Monmouth.
It is a pretty good place to be.
I agree.
Our department rocks, always has, always will.
I was gonna say, it's my first year. I graduated last year, and now this has been my first year without school for as long as I can remember. And so I really appreciated this as a chance to learn again.
That's great. Oh, does Dean have a hand up?
Yeah, let me see if I can. Dean, can you ask your question?
Yes, I can. Well, I have memories of being in Monmouth, but it was back in the dark ages of the mid 1960s. And I remember walking over to an area a block away from the old teak house off, what is that, Main Street? I don't even know the name of the street anymore.
Broadway.
Broadway? Yeah, and there was a park, or not a park, a cemetery, a block off of, and it was on a hill. The whole cemetery was a hill. And I asked my father, who was a Monmouth grad from 1928, and I said, it seems to be an odd cemetery. And he said, oh yeah, that's the 1918 pandemic cemetery. And they literally had so many deaths that they just stacked up the coffins and plowed dirt over it. And so the cemetery is 6 feet off the ground.
I had not heard that before.
Yep.
So,
and, yeah.
Oh, go ahead, finish your story.
No, that's it. Otherwise, as to optimism, pessimism, I think I'm unfortunately a little too set in my ways. I think the high point of my day oftentimes is to go into a grocery store and have maybe a 16 or 17-year-old young lady tell me that I should have a great day. And I think
where you can.
I think on one hand, I can tell you the number of great days I've had in my life. And on two hands, I can tell you the number of bad days I've had in my life. And I've never been aware of being able to be in charge of choosing whether that day would be great or not. So I'm just delighted that I would be wished to have a great day. And I guess I fall into this kind of realistic pessimism that if I have an okay day, that's going to be fine. And so I think I look closer at the house odds. If you're going to walk into a casino, you can probably sit down and figure out on your chart, as you described, approaching the crises in life. If you're going to play blackjack, whatever, you could probably figure out the house odds and then determine how you're going to, play the whole thing. And realistically, you'll probably do a little bit better, but I think the house is going to win ultimately. And that's where my pessimism steps in.
One thing I want to highlight from what you said, though, Dean, is that, you said if you have an okay day, that's just fine. And I think that actually is really important, because we can't control what happens to us, right? We can only control how we respond to it. And if we can find the silver lining in the mundane, then we should live a pretty optimistic life.
Right. But thank you for your insights.
Thank you for joining us and for the story.
If there aren't any other questions, I have a quick question for you guys, because this is making me feel all, reminiscing and everything. Because I see Christy, and Christy, I'm pretty sure you're one of the ones that we did the chair races around HT around the hallway. Were you part of that group? I want to know what your favorite memories of Monmouth are, because you guys were just saying how you miss it. Real quick, what are your favorite memories of Monmouth?
Are you talking to me first?
Anybody, because I know that that chair race is at the top of your list.
Honestly, I think my experiences when I was in college are different than what my experiences are looking back now, right? So I think now who I am now really, really liked the learning aspect of college. And I can think very clearly about, some of the psychology labs that I was in, teaching me the Barnum effect and all those fun experimental ways that I learned about stuff that I use now. Most of my favorite memories then I can't remember much of. But yeah, now I enjoy the learning part. What about you?
So I think I actually have the opposite. I enjoyed the learning while I was there, as noted by my great question asking in attendance. I miss the camaraderie. I miss opening a door and having friends right across the hall. I miss having a group of sorority sisters that were there in person. Life felt so much more at my fingertips because of the being on a campus. And it's really hard to think of people having kind of a stymied experience now because of COVID in college, because that was such a critical aspect of really kind of a lot of the maturing that I did over my time at Monmouth. And looking back, it's one of the things I value.
Can we popcorn this and ask somebody our next question? We want to popcorn over to Evie.
Everybody says this, but it's got to be sledding down the hill. And I mean, the real Wallace Hill, when it was steep and it was fun and it curved into the parking lot. And so it was a little bit of a risk taking, but that was it. Every time you would have that first snow, it was an unspoken thing. Everybody just gathered there and tried to dodge security while you were doing it. So yeah, I second what you guys said. I'll call on Krisha.
Wow. I think not every morning, but probably once every 2 weeks, I think about what my life would be if I still had the omelet lady, I still don't know how to cook a great omelet. And she just made the best. And the bow tie ballet. That's the other thing I regularly think about. That's definitely not my favorite, but that's what comes to mind is the food. So there.
Penny the omelet lady is still here, and she is still making wonderful omelets for people. And she is like on, I don't know how many generations of students now. Yeah.
Yeah.
She's
We should have an omelet soon for us.
She'll
for
have
me.
a video once in a while on Facebook that shows up where she's talking to students. So it's nice.
Yeah.
My 4 years at Monmouth were the happiest years of my life, and not just the college, but also the town. Life was just not very stressful in a small town like Monmouth. I had grown up in Chicago, and I always wanted to come back. And in 2003, I came back. I bought a house here, live right across the street from the college, and have my come here. Have my old college boyfriend now as my husband.
awesome. Yeah, and we see you guys around campus a lot. You guys make the most of. So, you know, you guys who are saying you miss it, you know, the youngs, they're back here and they're attending lectures and classes a lot. Yeah.
I'll have to check out the old Pioneer Cemetery that Dean Atchison was talking about and see how many of those gravestones indicate 1918.
Mm-hmm.
And it's nice to be able to do that, to live right here.
I would say I went to graduate school in South Carolina and haven't left, been here for almost 7 years. And I will say this, I miss that small college feel. I work at the University of South Carolina, and you can say it's there, but it's not. And so I definitely miss that. And I also would say, for those of you who are there from 2010 to 2014, Jacob Hutton at the Bijou, that's definitely something I miss. And all of those fun stories. So it was a great time. My husband thinks I was a different person back then. So it was really the best 4 years.
I would probably have to say my things. I have two things that I probably miss the most, which is one is sitting in the cafeteria after track or cross country practice, and we'd sit there for probably 2-3 hours just talking, and eventually they'd have to kick us out. But that was one thing I missed because, you know, we solved all the world's problems. But I think I also missed just like camping out in the CSB or the library and studying, like just finding those friends and sitting there. My best friend just took her step 1 test for her medical school, Kate Solsey, and seeing her studying all that, I'm like, oh, I miss studying with you and like hanging out in a room all day. So I think that's one thing I miss. I still get to hang out at the college because I live a block away. So I get to see stuff, but it's not the same.
Yeah, I don't know if I miss the friends being right next door or the classes more. I want to echo what I think Amanda is your name. I think I want to echo what Amanda said, you know, that camaraderie just, it's so unique. It really is. And it was just so fun. And it was all very genuine. You know, we were talking about that, the authentic relationships, you know, that really is what you get out of Monmouth, really.
Well, thanks for humoring me, you guys. I like hearing about all of this and reminiscing about your experiences. I want to be careful about the time. We said that this would last about an hour, and we're at an hour now. Jen, do you need to do anything to wrap things up here?
Yeah, just a couple things. I want to let you all know that the Office of Alumni Engagement has a few more events coming up. So next week is our Alumni Greek Week. So if you haven't seen the email, we have 11 chapters that are having happy hours next week and kind of getting together in their chapter units. And then April 15th is Scott's Day of Giving. It's our 5th one. So we're going to have a lot of fun social media activity that we can share memories. Of course, we would love for you to support the day. We also have 2 events on that day. In the morning, we have a coffee chat with Jeff Rankin, and he's going to talk about the history of Scott's Day. And then we also have a wine tasting that night with Sarah Walters that owns Market Alley Wines, and Professor Craig Vivian. So that'll be really fun. And then as a reminder, there'll be a short survey when you're done. Please let us know your thoughts for future events. And so many thanks to Dr. Wertz and Dr. Dopheide for sharing their time and their energy. It was such a great class. And everyone, have a great day and a wonderful week.
Thanks,
So,
everybody.
Thank you. Stay
Great
well.
to see all of you guys. Thank
It's
you.
really great. Thank you.
Nailed it. Nailed it. Good job. Bye.
Bye, guys.
Bye.
So I know Lena you're going to stay on, but it doesn't give me the option to leave. It just says end.
That's okay.
So
You can
I'll just, I'm going to stop recording.